Hi, I'm Dr. John Baca, foot and ankle surgeon at Dallas Podiatry Works, here to discuss things to consider when undergoing major reconstructive surgery. There's a lot of things to consider when undergoing a major reconstructive surgery. A lot of patients frequently focus on how many stitches they're going to get or what kind of plates and screws they're going to get, but there's a lot of home stuff that really needs to be thought about and evaluated way ahead of time outside of just the surgery planning. It's very easy for the doctor to go over technicalities of the surgery, but the recovery is what the patient has to deal with long term. And so I think there's a lot of things that they really need to think about and discuss with their family and friends ahead of time before they even schedule the procedure. I think one question you should ask is how long you're going to be off of your feet. Often reconstructive surgery involves a lengthy period of time of non-weight bearing, which needs to be talked about in detail. And often this is a range, sometimes 4 to 6 weeks, 6 to 8 weeks, etc. You need to discuss that with your doctor because the range is there for a reason. If the bone heals quickly in the way that it's supposed to, often it may be 8 weeks or 6 weeks. If the bone doesn't heal, it could be up to 10 weeks or 12 weeks. But the patient needs to be prepared for both situations when you go into surgery. Number 2 thing to consider would be mobility adjustments after surgery. Of course, you can use crutches and a wheelchair, but that's not always practical for long periods of time. I often like to talk to people about getting knee scooters, which you can either rent from companies or buy online. There are other walking assistive devices available online that can make it easier for you to get around, especially if you have to be off your feet for an extended period of time. Something else to think about is going to be transportation. If you're having surgery on your right foot, you're not going to be able to drive until you're done with a cast or a boot. So you need to discuss transportation with family, with friends, or consider ride-sharing options like Uber or Lyft, which you're going to need for a long period of time if you can't use your right foot. Home accommodations are sometimes the most important thing to consider when undergoing a major surgery, but they're often the things considered the least until after surgery is over, which can be a big deal. Bathing accommodations is something that you need to consider for at least the first 2 to 3 weeks after surgery. Often you're not allowed to get either the cast or sutures wet for a good 2 to 3 weeks. So you need to adjust for keeping that area dry for a couple of weeks. There are multiple types of over-the-counter cast covers on Amazon or in our office to keep the area dry. But those need to be looked at because often duct tape and trash bags are not effective at keeping the area dry. Another thing to look at is getting a shower chair. If you're not allowed to put weight on one of your extremities for a certain period of time, regardless of getting the area wet, you're going to need help standing in the shower. It's very hard to balance on one leg, so investing in a shower chair online can often make life very easy for maybe $30 or $40. If you have stairs into or inside your house, that's another thing you have to think about. Not everyone can go up and down stairs on crutches or on their butt for long periods of time. So sometimes if you have bedrooms that are only upstairs, it may be easier to make your bed downstairs so you don't have to travel up and down. Maybe bring some clothes down with you so you're not frequently going up and down stairs. And maybe making accommodations to the front of your house so it's easier to get in and out while you're staying off of your lower extremity. Making your house accessible to accommodative devices like crutches and knee scooters can also be a big pain after surgery if it's not looked into ahead of time. If you have furniture that's too close together, a lot of different surfaces like hardwood to carpet to tile, or lots of area rugs, it can be really hard to get around with some of these devices, which can increase your chance of falls. So that stuff needs to be cleaned up. Furniture should be moved apart, and area rugs should be removed while you're limited on your lower extremity after surgery. You should make sure that things around your house that you access on a daily basis are easily accessible. If you keep plates and cups very high in your kitchen, you're not going to be able to reach them. If you keep sleeping clothes at the top of your closet, you're not going to be able to get to them. Things that are low on the ground that you normally reach down to pick up are not going to be easy to access while you are off of your lower extremity. That stuff needs to be looked at and evaluated way ahead of time so that you don't run into problems after surgery. If you live by yourself, you're going to need help with normal chores around the house that you sometimes take for granted when you're mobile on both lower extremities. And by stuff like that, I mean cooking, cleaning, getting dressed, picking up around the house. You may want to consider either having someone come stay with you, at least for the first couple of weeks, or hiring someone to come to your house to help you do these things. Often meal prep in advance or purchasing frozen meals can make life really easy if you're not able to be mobile after surgery. The last thing to consider would be pets around the house. If you have large animals or even small dogs that need regular walking, you're going to have someone take care of that for you, because that's not going to be a duty that you're going to be able to take care of. If you normally have a dog or a pet go to the backyard, but you bring them in or clean up after them in the backyard, that's not going to be something that's going to be easy for you after surgery. I have a lot of patients who have either small cats or large dogs, which jump on them or run over them, and that stuff can't happen if you're walking around in a limited capacity. The last thing you want is to trip over your dog and further injure yourself after surgery. So sometimes boarding animals or having animals stay with friends or family can be something to think about. All of these things may seem minor, but they can easily become a huge impediment into your healing after surgery if they're not taken care of in advance. Again, my name is Dr. John Baca at Dallas Podiatry Works. Make sure and talk to your physician about these questions when you're considering a major reconstructive surgery.